And welcome back to Fox News Live. 18 minutes after the hour, the Omicron COVID strain, as fast as it's spreading, appears to be causing less severe symptoms. And scientists say that could be a sign of the end of the pandemic. Initial data from South Africa, where the strain was first reported, indicate deaths from Omicron actually dropped by a quarter compared to earlier variants. Now, the study says that deaths and hospitalizations will also likely keep falling in the coming weeks, ushering in a virus shift from pandemic to endemic. But it's still a very interesting debate. And so we wanted to welcome Dr. Anne Remoyne. She's an epidemiology professor at UCLA, a PhD, smart person who knows all about this stuff. I think I'm like most people. I think I'm probably enough already with the pandemic. I want this thing to be over with, but I think in the conversations I've had with you and in the reading I've done, it looks like this is going to stick around, and maybe we should just get too used to the idea, if you will, that this virus or variants of this virus will be here to stay.
Well, Kevin, it's really nice to be here. Thanks for having me. And this is a really important discussion to be having right now, which is, where are we in the pandemic and what do we expect going forward? Just like you, many people are tired of this virus. We're all tired of this virus. But I think that the data from South Africa, while very compelling, and the data that we're starting to see here in the United States, that this virus is less severe, it's so much more contagious than other variants. So when you have so many more infections, you're still going to end up with a lot of people in the hospitals, still a lot of people dying. So we want to do everything we can to be able to push down this virus and stop the spread of the virus. You don't want to just get this virus because it might be a little bit milder. We don't know about long COVID, so still a lot to think about.
Can I ask you about herd immunity? And I know this is something that we don't talk a great deal about in the press because we've all been focused so dramatically on what can we do to end the virus? What can we do to protect people from getting the virus? I don't hear as much about herd immunity. Is that a conversation that ought not be had, or am I placing too much emphasis on what could be a solution to some of the problem?
Well, that's a really good question, Kevin. And the situation is this. We have so many people who are not yet vaccinated. We know that people can get reinfected. We know that there are breakthrough infections. So herd immunity really isn't something that is on the table at this point anymore. I think what we have to think about more is having a virus that is going to be endemic, that we are going to have to be regularly ready to deal with it and to be able to manage it just like we deal with the weather. When we have surges, we have to prepare for it. We have to do the right thing. We have to, you have to get vaccinated. You have to wear masks. You got to do a lot of testing. Testing is something that we really need to be doubling down on right now. And that's how we're going to manage it. We're not going to get rid of it. It's going to be here with us. And so we're going to have to really start thinking about, how do we live with this virus? What are we going to do to live with it? And that is vaccinating the world, wearing masks when we need to, really high quality masks, not those cloth masks that are not going to be as effective, and testing.
Can I ask you about this idea of vaccination? Obviously, more than 150 million Americans have already been vaccinated, and yet I was just reading a study about what's happening in Israel. We could be looking at yet another vaccine or another shot or another shot or another shot. Is that the future, in your opinion, for this country and others?
Well, I think eventually what it's going to end up is like having a flu shot annually. We're still, I think that because we have so much virus circulating, because we have so many places for this virus to go at this point, we're still kind of moving in this direction. Right now, people who are immunocompromised can get a fourth shot, and that's going to be really helpful to be able to keep people out of the hospitals. What we have to think about here going forward, how are we going to keep people out of the hospitals? How are we going to keep these infections to be mild? That's through vaccination. So, I think we have to be really thinking about, what do we expect from vaccination here? We expect it to have to really make these infections mild, to keep our hospitals from being overwhelmed, right? And keep people from dying. Those are the things we need to be thinking about with vaccines.
Okay, in the 15 seconds, maybe 20 seconds I have left, should we be focusing a lot more of our energy on getting people abroad vaccinated, in particular in countries, whether it's South Africa or some of the other countries where people are coming here from, or even where they're not coming from? It would appear to me, need the help because we have access here. A lot of Americans need help. We also have to make sure we're looking out for our fellow man across the globe. Is that your perspective?
Kevin, as a person who's been working in Africa my entire career and working on global health, my answer is yes. An infection anywhere is an infection anywhere. And how do we fix that? We vaccinate the world.
Dr. Remoyne joining us, and we so much appreciate your time today. Have a good weekend. Thanks a lot.